We are live.
Well,
We are live. We are live. We see there's some people coming in. So as we are hello, I'm going to be saying hello to everyone. People are starting to come in into their participants list. So hello to everyone. We are here with Pete Blackaby.
hi.
Hello, Pete. This is our first webinar for the webinar series that we are starting on anatomy as a movement teacher. What is the role of anatomy as a movement teacher? And Pete is agreed to come in for the first webinar, which is a total honor. Pete is a yoga teacher in Brighton. We're both in Brighton, by the way, which is a little bit strange because we're both I'm in Hove, he's in Brighton, and we are kind of communicating through this way, which is a bit of a strange thing to do, but we could be sitting together having a cup of tea.
Yeah.
So Pete is a yoga teacher. He started his life with the younger community in the early 80s, and he then went on to train as an osteopath in the early 90s. So these two ways of working are both heavy anatomical structural disciplines, and his early yoga career was founded on an anatomical approach. So the intervening years have seen him move steadily away from the perspective from this perspective to one where sensation and perception are his main focus. And this shift has largely been driven by his growing awareness to how we meet the world. So I want to say hi to Pete and pass you on to the crowd.
Well, that's a good summary of what happened. So to recap, it's true that I started studying anatomy via the osteopathic schooling I had. And although I didn't really appreciate it, I think the Iyengar system in those days, late 70s, early 80s, was very structural, if not anatomical. I don't think we only did any anatomy, but the focus on structure, on alignment, on organization of body parts was, in a sense, coming from the same perspective. It was about organizing bodies in space. And I definitely gained a lot in my yoga world. Anyway, I gained a lot of kudos from having a lot of anatomical knowledge. And retrospectively, it's quite alarming to realize how much trust people put on you if you can speak a lot of anatomy. But it's also interesting to realize that knowing a lot of anatomy doesn't really help you with your movement. Otherwise, the world would be full of well-moving doctors and chiropractors and osteopaths, and it clearly isn't. The people who move well are often dancers and athletes and and Felden crash teachers. That's my wife just getting up the door.
Hello.
So, that was an interesting observation for me, because I would sometimes get dancers come to my class who clearly moved extremely well, who had no knowledge of anatomy, and I had no knowledge of anatomy and didn't move as well as them. So, that set me off on a thought process about what is the function of anatomy. And one of the, there's a lot of things that work for you as an anatomy teacher. You know where body parts are. As a teacher, it's quite useful to look at people, and you can sort of have X-ray vision. You can see where their joints are. You can see where they're moving from. And I think as a teacher, it gives you some kind of help in noticing where people's restrictions are. It's easier to kind of see where people are held up in a certain movement. On the other hand, from a participant's point of view, I don't think it's that helpful at all, because actually we don't meet the world anatomically, we meet it sensorially. And I guess that was the kind of recognition that I made, that to improve movement, all animals, all babies, they learn through sensory exploration of the world. They don't learn through studying anatomy and then working out how to move. And that's a kind of fairly profound observation, actually, when you let that land. So I then started thinking much more and studying more a relaxation, how it is we learn about our bodies, where it is in space, how we move around the world in space, how we relate to space and people and the world. You know, that became a more interesting topic for me. So that's where I am at the moment.
Great. Well, it's great to hear. I mean, obviously, completely agree with the sense of the, you know, anatomy as a mover is not necessary. How about the teaching of anatomy, which is kind of the topic, you know, rather than anatomy as a mover? But what about the teaching of anatomy? Sorry, the teaching of movement, the need of the study of anatomy for the teaching of movement. Yeah,
well, I was talking to my wife about this the other day. She's been on many Feldenkrais training courses, and Feldenkrais is very much about movement, but they don't teach anatomy on it. And I think that's interesting. It's not a foundation part of their course. I mean, they might have a skeleton in the room and point out where hips are and where shoulder blades are and what a clavicle does, but fundamentally it's a very small part of teaching, and I have a lot of sympathy with that viewpoint. You know, obviously, as teachers in a room full of students, I think anatomy, as I've just said, helps you visualize more clearly where people might be caught up in their bodies. And you can also, you know, having an understanding about anatomical variations is quite useful, because you can say to someone who can't sit easily on the floor and someone who can, that might be to do with just the shape of your hip joints and or your shoulder or whatever it is that's restricting them. So from that point of view, anatomy can be a useful tool to help to reassure people that they're not, you know, incompetent in their movement. They've got a different anatomy to somebody else. And I think that's something that we should all know, that we can't expect all people to take up the same shapes in space or the same kind of movements. They'll all move differently because their anatomy is different. So there's that. But when it actually, what worries me about anatomy, teaching anatomy to movement, and my anxiety around it, if that's a thing I am, and maybe I am a little bit, is a tendency to reverse engineer. Because I mean, it's very, very common in yoga classes to hear people talk about a muscle. You know, you should engage this muscle. You should, I don't know, try and strengthen this muscle or stretch it or engage it in some way. And that's a very strange thing to ask anyone to do, because that's just no creature on the planet ever thinks like that. You know, what we have is an intention, what we want to do, and then we carry it out in the way our body has mapped the movements through previous experience. So the mapping of our body's sense of itself and the way it moves in space is a very interesting subject, and that's how you improve movement. You don't improve movement by trying to break your body into bits and think about your body in bits and work on your hamstring or your quads or your core or your fascia or whatever part of the body is precious at the moment, you know.
Yeah, that's something that interests me a lot, and is one, you know, the reason how this webinar started, just to kind of ground whoever is watching this. It all began because of you know, I was having a lot of you know, thought process around this, and I posted out on Facebook a post saying, the study of anatomy as a movement teacher, 1, is it useful? 2, is it necessary? Which is obviously a different question. And 3, does it get in the way? So I suppose for me, what comes out of like this process of thinking is, I mean, I teach anatomy to movement teachers. So is in the approach of how can I create an environment in which we're not just learning anatomical structures for themselves, but where we are visiting a particular structure with an intention of understanding it as part of the whole. And most importantly, can we create an environment in which that person has an embodied experience of what whatever that means to that person. So yeah. So and not necessarily, when we are like, when we're going into it from the felt sense, what is it that we are feeling? When people say, oh yeah, I feel my psoas, or I feel my.
Is it important?
For me, it's very useful. For me personally, as a being that moves and breathes, it is very important in my journey. It is very important to study anatomy, and this comes from my own visual world, in which I go into these places in which I create through perhaps my imagination, but really feeding into what I sense inside me. And yeah, I have found immense use in understanding the visceral world, for example, and or getting to sort of dive into the visceral world, understanding the visceral world, maybe a bit to say, and how through kind of getting to visit the body, whether it is through books or whether it is through dissection or experiencing working with the anatomy of another person, which for me is, or of my own body, which for me is also a study of anatomy, can really enrich my own movement and my own breath, and it can also enrich what I then perceive when other person is moving. And something that you touched on, which I think is really important, you said it can help me see. I don't know exactly how you put it, but something about, for me, when you were saying it, is this sort of like there is a wave of movement traveling through a body, or a body is producing a wave of movement, and then there seems to be an area in which that movement gets either a little bit stuck, or the wave seems to no longer flow.
Yeah.
And then for me, at that point, to have a little bit of a sense of what kind of structures there are around that area.
Yeah, I would agree with that.
Yeah, whether it is viscerally, or whether it is fascially, or I don't know if you can really separate it viscerally, fascially, or vascularity. What kind of landscape there is in that area, and what are the textures, and what are the so how can I perhaps, through my language and through maybe my hands, or maybe the movement that I suggest, enhance a person's experience of movement, or help that person enhance their experience of movement.
Yeah, I mean, I have a sympathy for that, and I understand. I think we can use anatomy sensitively, but I think it's often not done like that, and maybe that's my worry. It's more reductionist. It's more fragmenting people. I endlessly see workshops on the hip joint, or the knee, or this part of the body, or the core, or their fascia, or whatever it is, And then we start to, I think what happens to the students is they get very interested in the bits of themselves, and stop feeling themselves as whole human beings interacting with the world, and start wondering if the parts of them are working properly, or doing what they should. So they ask themselves these questions that would never arise if they didn't know anatomy. And you can, it's a harder job, I think, but perhaps perhaps a more rewarding one, to help people talk about sensations and the way they perceive those sensations and what they mean to that person. So the language of perception and the language of stuff. So it's relatively easy to talk about a psoas muscle or a bit of fascia or a, you know, a femoral condyle and the scapula, and because they're substantial and we can see them. But to talk about the felt sense or the relationship between things, a sense of movement, a quality of smoothness or weight or freedom or lightness, these are the way we actually meet the world. We never meet it with anatomy. And I think the danger for me is that we get seduced down the anatomical path, even in a very sophisticated way. So we can talk about it in a very sophisticated way and get into the subtle relationships between you know, fascia and bone and connective tissue and the fluids and the way they move and poetically describe them. But actually, you're describing something in a form that is felt and that has another language. So there's a language about objects and there's a language about relationships between objects, and the felt sense, which is not an object. It's a feeling, it's a sense, it's a perception. And I think they're almost two different subjects. They do obviously have a blurred relationship between them. But the seduction of the object is a big one, because it's so easy to be clear about. Talking about feelings and felt sense is elusive and mercurial and difficult to pin down. And I think we've struggled with this. I mean, in the yoga world, I suspect we've been struggling with this for 2,000 or 3,000 years and coming up with all kinds of imagery to help support those feelings. And I suspect a lot of the energetic systems in the body are metaphors for experiences that are ephemeral and not substantial. And when we substantiate them, we kind of make them grosser. However poetically we do it. So I'm talking about from the participant's point of view here. I think
from the participants, yeah.
Yeah, from a teacher's point of view, I see anatomy can be more useful in the way you've described and I've attempted to describe, in the sense that where people get caught up in their movements or their body, you might have a clearer sense of how to help them. But you wouldn't help them anatomically, you'd help them by suggesting through the felt sense, of course.
I mean, yeah, I mean that's clear. Not clear, but that's something that you can't help them anatomically, can you? Because you can't do something to them. They have, it's something that they experience. So change happens from within. Is almost
a change in perception.
A change in perception, and also is a choice to a certain level. Is a choice, whether it's conscious or unconscious. You know, is a choice. A choice. There is something I was reading some of your articles that are on your website, by the way, today. Really interesting. If anyone that is watching wants to go into Pete's website, we will put it on the chat as well, so people can go and have a look. There's some great articles, and there's an article on responsiveness that you've got, which I thought was very interesting to read. I mean, all of them very interesting to read, but I was yeah, you know, how you were talking about how we respond to sensation, and how I'm gonna quote you here, or kind of try to sort of say what you're saying, then you can expand on this. But you were talking about the dulling, and I can't pronounce it, the dulling of sensation when needs are not met. So how we can lead to a point of shutting down of our feelings, and that leading to a state of dissociation. So that really interests me, because obviously, you know, it's through that state of dissociation that movement I suppose, gets diminished because there isn't that felt sense. And I completely will not only agree with that, but, you know, there is no, I think there is no doubt about that. We can say that.
Certainty, but, yeah.
But in terms of like, so in cases like these, to intend to encourage movement and to kind of promote the felt sense within that person. Of course, what I have seen in the past is and I've experienced this in my own skin. I've got a lot of I'm a Pilates teacher, so there was a big part of my beginnings which was all about the core, and I've got a scar running all the way down through the front of my trunk. Yeah. So the core was an important part of you know, the core, whatever. That's another webinar on its own. Let's leave it alone. But my meaning being, you know, I had a lot of other Pilates teachers at the beginning, like poking my belly. Yeah. And going, oh, connect more. And I was, you know, I'm a good girl as well. I went to Catholic school, so I tried really hard. So I will just then go and try more. But you know, scar and the trauma behind that, and when you know, there was a level of dissociation within that area, which it was only through understanding that this wasn't working. I couldn't connect my transversus abdominis. I couldn't, it was a completely dissociated feeling. So going back to your writing, yeah, how, I suppose it's a very open question, how can we encourage movement and coming back to that felt sense? What strategies can we find in order to?
Well, you know, I guess different teachers have different strategies, and but the, you know, if you worked with, and from time to time I've worked with people who are so out of their bodies, you don't know where to start. They don't seem to be able to feel. I mean, I'm remembering a man I used to treat as an osteopath who would say he had a pain in his leg, and I remember asking him when it hurt. He said, when I walk. And so I remember walking around my yoga studio with him and asking him, well, where does it hurt? And he said, well, it's just my leg that hurts. So whereabouts in your leg? He said, well, I don't know, just my leg. And at some point, you know, I said, well, you know, let's try and do some other things. And we got to a point where I had him on the floor and moving his leg around a bit. And he got up and said, I don't want to do this anymore. You know, I just don't want to do this anymore, because I think I was just starting to get him to get in touch with feelings. So you sometimes have to zoom right out and start with very, very small things. Lying someone on their back and asking them to feel a footprint on the floor is a start in someone who doesn't know their bodies. And then you gradually creep up on them from that, and you can then develop, of course, more and more sophisticated. You can ask more and more sophisticated questions about what do they feel when they do this, what happens when they do that. And for me, you know, yoga has these days become really a sensory exploration of movement. What do you notice in your body when you do something? And that's the only question I'm ever asking these days. What do you feel? What do you notice? What happens?
Can I expand a little bit on that? On what do you notice? A conversation that I had with another teacher who came to do a session the other day, and he was expressing a frustration because of this question. You know, when he was asking, "What do you notice? What do you feel?" and to a particular client that he had, and I don't know if he might be even one of the attendees today. Anyway, he was telling me that every time I ask her, she just says, I can't feel anything. I can't feel anything. I can't feel anything.
Yeah.
And so we went into this conversation, and obviously I have had that happen before with people. So through our talking, I said, well, what about if you just ask her what she feels, and then, when she's saying I can't feel anything, so what do you feel? And then she might come back with nothing.
Yeah.
And so there's a starting point. She feels nothing. So that's something. She feels nothing.
Yeah.
So to actually get someone to that point where they realize that they're dissociated, not realize I don't feel.
I don't notice, I think, is the thing. And that's the interesting thing, isn't it? I mean, you put an ice cube on their foot, they would then go, yeah, I can feel that, you know. So you can always start with some, I mean, I wouldn't suggest that's how we start, but, you know, but there's always a way in, you know, you can create a way in for people. And then, because discrimination of sensation, I mean, I remember it very well myself when I started doing yoga. I mean, in Iyengar yoga, it wasn't a felt sense kind of yoga, it was a tell you what to do kind of yoga. But my first teacher, I remember asking me to feel the floor underneath my feet in Tadasana and standing. And I was completely puzzled by the question. I remember that feeling of puzzlement because I don't think I really understood. I mean, it's an odd thing. I can't quite remember how mystified I was, except I do remember feeling mystified. I obviously couldn't really sense under my feet at the time. And I think for a long time doing that kind of yoga, it didn't improve, or the only way I felt myself, and this was perhaps what was quite useful for me at that time in my life, was I could feel strain because I was being asked to push myself. And I learned to meet my body through stress and strain in Iyengar yoga. And maybe that was a good entry point for me because I was a fairly undisciplined young man, and that brought some kind of quality of feeling into my body. And I remember when I first came across a teacher who asked me something different, a woman called Mary Stewart, who was what I call my transitional teacher, the one that took me away from Iyengar in a more sensory direction. You know, I remember her asking me to keep doing less, you know, than I was doing in the class. And I remember almost bursting into tears because I didn't know what it was to be in a body that wasn't doing a lot. You know, I couldn't feel myself in a discriminated way. I could only if I felt myself stretching hard could I really notice myself. And when I was asked to reduce that, it was like I was disappearing or vanishing in some way. But since then, I've become aware that it's a vast universe of experience. You know, the sensory world, and the levels of discrimination, the qualities of feeling that we have, are so useful to us. And a man who has been quite influential in my thinking, a psychologist, neuropsychologist called Antonio Damasio. Do you know his work?
I have heard of him, and I've read through your articles that you mentioned him. Yeah. And so you've kind of like whet my appetite to go and read him now, because I have heard of his work before.
The feeling of what happens is perhaps the kind of formative book of his. It's not his first book, but it's the one that I think he articulates this idea that the sensory nervous system evolved to keep us safe, which is obviously true when you stop to think about it. You know, we have sensations to stop us falling off cliffs. That's why we have sight, you know, hearing to make sure that something doesn't creep up on us, or, you know, a sense of touch to make sure we're navigating the environment we're in well. But he also goes on to expand about interoception, the feelings of emotion. And he argues, I think very cogently, that feelings, particularly the uncomfortable feelings, are again to keep us safe. So feelings of fear, of anger, of loneliness or sadness, the things that we clearly embody, you know, the things that we feel in our heart and in our stomach, are there to help us navigate our social surroundings, our communities, our families, in order to help us navigate when things are going well and when they're not going well. When we're in danger of falling out of a friendship group, you know, that's why we have feelings. That's why we have those senses to help us step back when we need to step back, to join in when we need to join in, and the feelings that accompany them. And I find that a very compelling argument. And if you think that all sensory experience, and if you include interoception, proprioception, and exteroception as the ways we experience the world and our internal environment, as means of navigating the world that brings us to the most harmonious relationship with the world. I think it's a profound insight. And if you really focus on that, and if you really pay attention to that, and don't get too distracted by anatomy, I think it's deeply helpful.
Mm.
That's what I was trying to write about in that article.
Yeah. No, I completely agree in the whole felt sense, interoception, exteroception, and going through the felt sense is definitely the way.
Yeah.
Is there a way just to kind of like, is there a way you think of, you know, because obviously there's so many ways of like studying anatomy, and I don't want to kind of go on too long because I did say it was going to be half an hour and there's going to be time for questions and answers, and it's already 33 past, but just to say, so there's so many different ways of studying anatomy. So there's obviously the more structural type of anatomy in terms of just looking at the muscular relationships, and
yeah, sure.
you know, you don't get all these people queuing like I don't know, you know, connect your serratus anterior or yeah. So it's like, what does that mean? You know, and I don't know what that means. You know, I can know what the serratus anterior is on a piece of paper or on a cadaver or in someone, but how can I connect that? It's not how the body works. It's completely not how the body moves. So there's obviously that part that is like anatomy is, for me, gets in the way. That would for me be the place where anatomy is getting in the way. Yeah. Is there a way, do you think, have you experienced a study of anatomy in which you are increasing your felt sense through the study of anatomy? Have you had that experience?
A couple of things I think are useful, but not many, but I think there are a few things. One is if you've got a skeleton in a room, you know, the transmission of force through bones. If you can demonstrate it on a skeleton, you push through a foot or an arm and you can see the rest of the body move, and you can say forces are transmitted through bones. I think that's a very important thing to help people with, so that when if they're on all fours, for example, they can think about the bones as columns of support, something that takes away the effort from their muscles, so they can lean through bones. You can use bones to support you. That's a good thing to understand, and you know, to have a great big femur next to you and get a picture of you know, that big bone that you can lean through, it is, I think, quite a helpful image. I think the idea that connective tissue, fascia, whatever we want to call it, in a sense is good at resisting forces, resisting tensile forces, pulling forces. And you know, that sense we all know of tension in our bodies, or the pulling tension in our bodies when we bend forwards, is a kind of connective tissue felt sense. That can help us, because again, that's releasing our muscles of duty. Grachovetsky, you know Grachovetsky's work, yeah, I mean, he explains that so clearly about the lumbar-dorsal fascia, how, and you know, when all this confusion comes up in yoga, I don't know if it's the same in Pilates, but you know, are you allowed to bend your back? You know, it just makes you want to weep, doesn't it? But, and yes, so his explanation of how the lumbar-dorsal fascia supports the lumbar spine as you bend forwards is just a useful way of using anatomy to explain why it's safe, you know. So, and he was the one who said to me, you can't use anatomy to teach people how to move, but you can talk about movement and then use anatomy to support a functional argument. But it supports a functional argument. It doesn't create the argument for movement. So, and I found that very illuminating, because, you know, the idea that we have to maintain some kind of, this came up in a class I was teaching the other day. There was a woman in the class who'd been told by some anatomy teacher, I think it was a physio of some sort, that she had to keep a lumbar curve in her spine all the time, when she was sitting, when she was standing, when she was bending forwards. I just thought, how difficult your life must be, you know, to do that. And what a mistake in thinking it is. And this is a way of thinking that's been taught through some understanding that if you bend forwards, your discs will pop back and burst. You know, it's a strange anatomical mistake to make. So, you know, bones transmitting forces, connective tissue resisting forces, muscles generating forces. These are solid bits of anatomy that are useful to contemplate, to think about. I think it's useful if you've got a skeleton to show people where the hip joints are, because most people don't know. They think they're much further out than they are, you know, and they're often surprised, you know, and that the scapula is to the by a clavicle, you know, and it floats around quite a lot. These are quite useful things to imagine and have images with. So to have those kind of visuals in your mind, I think, can be helpful. But when you get too detailed, I mean, don't get me wrong, I am deeply fascinated by anatomy, and you look at some of the recent anatomical videos you see, you know, the one of the camera under the skin, the journey under the skin, I can't remember what it's called now. Okay. It's just fascinating to watch. You just Gumbato, yeah. It's just brilliant bit of cinematography. Doesn't really help me in terms of movement, but I'm just flabbergasted by what you can see, you know. But the other thing maybe is the explanation, you know, as I said earlier, anatomical difference. I have somewhere on my files, I've got an x-ray of a contortionist doing a back bend, and it's quite useful to show people, look, when contortionists do back bend, this is just happening in the lumbar spine, nowhere else, and this is genetically determined. It doesn't happen through lots of practice. It happens because you have this kind of a lumbar spine and this kind of connective tissue. That's kind of useful to help people with. But that's about as far as I go these days. I'm in the minority, I realize that.
Right. Yeah. So I'm still interested. I mean, I could carry on talking all night just about this and keep finding examples and finding, you know, those were great examples you gave. I personally I'm not gonna. I can't stop. So. Just for me, one thing that comes up also is the lack of within the movement world, when I first started studying anatomy, and when we all first start studying anatomy, we get taught about bones, and we get taught about muscles, and we get taught about, and no one tells us about viscera. No one tells us about you know, there's this whole world missing, which takes up most of our body, and it has so much fluid movement to it, and you know,
well, the fact that we're
a lot of influence in our movement.
Yeah, we're 80% water is often missed.
Yeah, and you know, if you do end up in a dissection lab, and you do, you know, first time that you go in through your abdominal muscle or through the abdominal muscle, you know, I was completely you know, blown away, like, oh my god, this is just immense, this world, and no one's taught me about it. And Pilates teachers all over the world going around talking about you know, muscles, when in fact the muscular wall is you know, not very thick. So yeah, there's for me there is a lot missing in the anatomy that is taught.
Yeah, and you know, I always felt I felt that very strongly when I first went to the Body Worlds exhibition. You know, it was just deeply fascinating. I mean, it's a bit terribly dry. You know, not a drop of liquid anywhere.
No. It's been plastinated, hasn't it?
Yeah, it's all plastinated. Yeah. It reinforces that idea that we're kind of mechanistic. We're kind of machines and
organisms.
Yeah, and really we're fluid organisms, pulsating and expanding and contracting, and you know, that fluid sense of ourselves with the breath is a part of our felt sense, you know, and to try to lead people to too much dryness, you know, is really a mistake. You know, but the truth is also, I think, it's true that we've got organs inside us, and you know, fascia and all these other interesting bits, but we're still left with ourselves as feeling beings, We don't know that it's a liver we're feeling or a spleen we're feeling. That's not what we experience in ourselves any more than we feel a serratus anterior. You know, we're given all these parts of ourselves names, and then we give importance to those names. But there are plenty of creatures on the planet that get around perfectly well without knowing the names of any parts of their body.
Sure.
And navigate it very skillfully. And I do the study of anatomy and the study of movement aren't the same, I don't think. And I've increasingly I increasingly feel that. I need people like you probably to pull me back. I could just drift off the planet anatomy completely, you know.
Oh, Pete, it's a pleasure talking to you. I'm gonna look over to, because I see that there's only one question that I can see. It's 43 past. I think we should go over to our questions. Actually, there are a couple of questions.
Okay.
So Catherine, hi Catherine, she's saying, do you find that people feel the need to hear that encouragement, to hear feedback in class, to hear that they might be getting something right, which is why we hear quite reductionist anatomy cues? Is that clear? I haven't read that very well. It's a bit complicated.
Maybe.
You find that people feel the need to hear encouragement and feedback in class, to hear they might be getting something right, which is why we hear reductionist anatomical cues. It's like our own need to have something dictated by another. I find this interesting, an interesting tendency.
Yeah, well, if I've understood the question, I may not have understood it, but if I understand the question right, if you're cueing somebody to do something, you know, in a class, and they respond with the right response, then you say, well, that's good. In a sense, you've just maybe confirmed that they've done what you intended them to do. To cheer that person up in some way, to make them feel that a little bit better about themselves. If it's an anatomical cue, or if it's a cue about position in space, I'm not that interested, and I think that's a mistake. I will be encouraging if I see somebody's shoulders relax when they find support through their skeleton, through their arms. I might say, that looks a bit more relaxed, that's nice. Or if I see some breathing quieten down, I may say, oh, it looks like you've lost a little bit of tension in your breath. And I think that these kind of things, when you see that people are finding support, their breathing is freeing up, they're kind of sensory responses that I think are useful. But I'm less likely to tell people they've done a good job in their shape in space.
Yeah. There's another question by Jennifer. And she says, hi, Pete. What part do you feel our organic body, intelligence or intuition contributes to movement? If that's not too simple a question.
Well, you know, obviously the thing about movement is we don't start off with intelligent movement. You know, we come out of the womb not really knowing how to move apart from a few reflexes. So the intelligence is developed through practice during life. You know, babies and young kids, play is an important part, and exploration of the world, and all those things we do to map our bodies and learn how to become intelligent. So it's a process, and of course in a modern world that process is sometimes, I mean, what a question that does interest me, and maybe is behind her question, is why are so many people not intelligent in their movement? You know, because we all come into the world the same. And I think there are two or three main things. You know, one is a lack of repertoire of movement. We live in fairly sedentary world, so we don't do much, or many people don't. And so you just don't get very skillful at doing anything. You know, we get skillful at sitting in a chair or moving from your house to your car, or from your car to the office, and that's about it. You don't have to be particularly good at that. But we can also be encultured into sitting up straight, standing up straight, you know, being good people, presenting ourselves to the world, that just stiffen us in unhelpful ways. And we can be frightened. you know, which also stiffens us and restricts our role of movement. So I'm more interested in why people lack intelligence in their movement, competence in their movement, and have a lot of sympathy for that. You know, how do we help people find themselves and learn to move more easily? That's the question that interests me the most, probably.
Yeah. Thank you, Pete. There's a couple more questions. There's someone talking about the autonomic nervous system. So Jonathan is saying, thank you so much for your time. I'm interested in the thoughts in any thoughts on the importance of the autonomic nervous system state when working with the felt sense. I mean,
well, I think we can get caught up in, we're really talking about relationships all the time. Is the relationship I'm forming with someone, either in the yoga class or if I'm treating them on a couch, one that is helping them calm down, feel themselves more in a non-threatened way. And of course, the autonomic nervous system is the name we give to the process if people calm down, you know, the parasympathetic nervous system. But I'm scared again, you know, that we stop thinking about a person and start thinking about a part of a person. So, you know, in my kind of career, I've been through phases where the psoas muscle was the most fashionable thing to talk about. I've been through phases where the core has been very fashionable, where fascia has been very fashionable, and now it's the vagus nerve is very fashionable. So, you know, and where these are bits of people. I work with whole human beings, and I'm interested in forming relationships on any level that is harmonious, that helps us both, that it lowers our defenses without muddying our boundaries. You know, that's what I'm trying to do. And I guess the expression of that through the nervous system would be a sedating of the sympathetic one and the engaging of the parasympathetic one. But I never think like that. I look at the responses of a person and see what their face is doing and whether they're smiling or relaxing or becoming tense, whether I've made them anxious or not. You know, they're the questions that are going through my mind.
Yeah. Great. There's one from Anil. He's saying, question for both Pete and Anna. Is it still important for students to know about the iliopsoas? Mm-hmm. If it is impacted as part of a stress response, should we not be discussing it with the students given that they cannot see it?
Yeah. Hi, Anil.
Hi, Anil.
Well, my own view is you could show them a picture of it. You could, if you have a model of it, you could show it to them and say, look, these muscles do tend to contract, and the effect it might have is stiffen your back and tighten your hips, you know, something like that. But what I would be more inclined to do is think of a movement that engaged those muscles or that area and say, what does that feel like? And then what does it feel like when you stop doing that? And learn to notice the difference between an area that's tightening and then an area that's releasing. How does it feel when those muscles are active? What is the sense you have of yourself? And then stop doing that. What does it feel like when you stop doing that? You know, I'd be more interested in helping people navigate the felt sense of it rather than to try to intellectualize where it starts, where it finishes, what it does, you know, because that just puts something in the way, I think. Although,
yeah,
I know people have written books.
I think for me is a difficult one because of focusing on one muscle and giving one muscle, which of course is an important muscle, but aren't they all important? So with that also being, is it the iliopsoas that is contracting? Is it the iliopsoas? We know that it is that, or is it, yeah, what is it that is contracting? Is it the iliopsoas? How can I, perhaps, I wouldn't necessarily mention the iliopsoas and perhaps more bring the intention to the breath and have a sense of the movement within the abdomen through the breath, and a sense of the different layers of movement within the depth of my abdomen, and yeah, how that sensation responds to movement. And yeah, I will go from that. And then creating some movement that perhaps takes me into moving the legs in some way, and how can I initiate the motion of the legs, perhaps from the intention of the breath. What's the relationship within the movement, between the movement of the leg in relationship to the sensation inside the abdomen, or even going farther into the center of the chest and the heart. And yeah, I don't know if this makes much sense. That's the way I perhaps would go. Can we, so there's one more person who's put another couple of questions, Pete, and these are the last ones. And she's Jill. Hello, Jill. Jill has written 2 questions. One is saying, Pete, it's going to you. Do you think that the study of anatomy earlier in your career has allowed you to become the teacher that you are, and ultimately use select anatomical references to encourage the felt sense? I'll read you the next question. To elaborate, did the study of anatomy allow you to understand it enough to limit its place in your teaching, so to speak?
Yeah, I'm often asked that. And it's a difficult question to answer, because many people have said to me when I've argued the argument I'm making now, it's all right for you, Pete, you know your anatomy, so it's all very good for you to say, forget it. And maybe there's some truth in that. Maybe I have the confidence to let it go because I know it. On the other hand, I do think for many years it led me down the wrong path. I think for many years I taught yoga in a much less than helpful way. So I had to unlearn a lot of the anatomy. And maybe that is part of the process. Maybe you have to learn it to unlearn it. You have to have you have to take the mystery away, and realize it's a separate subject. The subject of objects and the subject of relationships is, I think, 2 separate subjects. And, although there are places where they touch quite closely, I think once you've clarified that in your mind, anatomy can fall away more than many people believe. I think we hold on to it a bit like a transitional object sometimes, like a baby, to reassure us. But yeah, I may be culpable. I may be guilty of sitting on a lofty perch and saying it's not important because I know it. It could well be true. So Jill, you might have caught me out.
Well done, Jill. Okay, so they keep coming. We're going to answer one more, and then we're going to let you continue on. If you want to carry on, you can go onto the Facebook group and ask questions there. We'll get Rosa to put the Facebook group link on the questions. But there's one more, and we'll finish there. So Lucy is saying, hi Pete, and is saying, is there any need? Is it useful to talk about anatomy when teaching pranayama? Thank you.
No.
Right.
It's a simple answer. Because it's the same as movement. Perhaps the biggest difference between breath work and movement work is we've always known how to breathe, whereas we haven't always known how to move. So problems with breathing are never that we've forgotten. We need to remember and find out anything that's got in the way of our breath. And that's usually learning how to notice the unconscious things we do that stifle our own breathing. And they're the feelings of stiffness, of tension, of worry. And as they drop away, breathing will restore itself.
Okay. I will have, we'll carry on talking about everything, Pete. Breath interests me greatly, and I have found some interest. I have found some personally, breath has really been enhanced by exploring what is within for me, and how you know, the expansion of my lungs can go out, can go up, can go down, but also can go in, for example, and come in towards the mediastinum and to relating to the heart. So for me, the understanding of anatomy has really helped me with my own breath. That's not to say that, of course, you know, I'm not able to go here, diaphragm, diaphragm and contract, so that the diaphragm can start to go down, and you know, obviously that would be completely not very clever. But yeah. Yeah, anyway, we could carry on talking. There's so much that I want to talk to you about, Pete.
But we'll have a cup of coffee one day.
Maybe we should have a cup of coffee somewhere in Brighton. Yeah, thank you so much for
you're very welcome.
For starting this conversation with me. And you know, it's great to start with you as well, because in a way you're bringing this view of the felt sense, with which I agree 100%, and it's so interesting to hear you. And is an unusual first speaker, I would say, because you know, it will be a lot easier to begin with someone that was saying anatomy and hearing.
I'm sorry, I realised I put you on the spot a bit here, haven't I?
and you haven't, you know, because otherwise I would have never asked the question on Facebook had I not been agreeing with, you know, with your with the sense that, you know, it is the felt sense that we move from, that is not from the body is not in a mechanism. And great. So thank you so much for joining us. To our participants, if you are attendees, if you want to continue, go into the Facebook group. The link is on the chat, and you can carry on. We can do some more questions and answers there. You can talk amongst each other as well, and comment on each other's. You know, there's a wealth of knowledge on the chat as well. So you go and keep on keeping this discussion live, which I think is an important discussion. Not with the means of like, let's promote anatomy by all means, but quite the opposite. Let's you know, I'm interested in opening up the discussion to hopefully see anatomy being taught in a different way, or being approached in a different way in the movement world, which I think is very much needed.
I agree.
So thank you very much, Pete.
Thank you. I've got to cook now, so.
Great. Well, enjoy your cooking.
I won't be on the Facebook chat right now, but I'll have a look at it. I'll have a look at it later on.
Great. Before we go, I just want to say to everyone that has attended that we have another webinar next week at 7 p.m. again. This time we will have Stefan Westerback from Finland and Tracy Mella, who's also local. So we will be talking some more about anatomy, and they will bring a different their own approach. Of course, everyone's different, and they will be bringing some interesting talk about the whole human fascial plastination. So yeah, we look forward to speaking to them then.
All right.
Thank you so much.
Thank you very much. We enjoyed it. Bye-bye.
Thank you. Bye-bye. Bye, everyone.